We'll
Yeah.
move on now to our keynote introduction from Becky Curran. Make your ideas stick, how to creatively engage audiences and inspire accessibility in healthcare.
Hi, everyone. I'm Becky Jackson Curran. I am a Senior Director of Stakeholder Engagement at Disability In, where we work with business to advance disability inclusion. I am currently wearing a green shirt. I have pulled back brown hair. I'm Caucasian, and I have facial features as I am someone with dwarfism. So I am going to introduce you to Rashika Kartik, who will be presenting Make Your Ideas Stick: How to Creatively Engage Audiences and Inspire Accessibility in Healthcare. Rashika is a senior at Brown University, creating Brown's first major in accessible design. She is the founder of Touch and Create Studios, recognized by the United Nations, White House, and Andy Warhol Foundation. She's also a viral TEDx speaker, so please watch that if you haven't already. And at the Barbara Davis Center for Diabetes, she led research on making diabetes technology accessible to blind patients and published as first author in a top 10 field journal. Let's give it away to Rashika.
Thank you so much, Becky. It's a pleasure to be here. I appreciate the gracious introduction. As was said earlier, my name is Rashika. I'm a senior at Brown University. I'm a short, unfortunately, Indian woman with long, dark black hair that's curly. I have sparkly makeup on as I tried to imitate the 2016 makeup style. And I have pink lipstick, and I'm excited to chat. I'm wearing a dark collared shirt. So this session is about how to creatively engage audiences and make your ideas stick. On the slide here, I have a form of art, three close-up pastel drawings of brown eyes with rainbow eyeshadow. And by the end of this presentation, hopefully you'll be more inspired to bring out the artist inside of you and understand how creative storytelling and art can improve the implementation of the grand ideas you had. We live in an information era. Constantly, we are bombarded by facts, opinions, data. It can be hard to figure out what to do or what we think. And I believe this is why, despite humanity always being creative and having many brilliant ideas to share, we often feel burdened by this information, and great ideas don't take root and actually take action. I remember one time I was doing a project in college where we were talking about environmental awareness, and I thought, oh wow, there's a lot more that I wanted to do in my community regarding the environment. So I went online and I searched, how do I improve the environment? And within 15 minutes, I got a ton of conflicting information. Donate money. Donating money is problematic. Go work in your community. The best way to do it is to support others who are already working in the community. There are even oil companies who are claiming that the only way to truly help the environment is to support them by giving them a profit. We can understand why people aren't moved by numbers or facts. Ultimately, we are moved by our everyday experiences, by the stories of humanity, by people. I think we are moved by feelings, and we are moved by art. In a world that's increasingly globalized, in a world that we want to be more inclusive, we want to speak the universal language of art. Art allows us to translate ideas across beliefs and across people in order to create change. So here's a drawing that I made of the information era and the overload that we feel when we have all this information. So the question that drove me to study accessible design in undergrad was, why do good ideas still fail? I felt very inspired to pursue disability advocacy because I grew up across from the Colorado Center for the Blind. So I had the unique opportunity of being surrounded by independent, wonderful blind people who were participating in civic life, painting, running businesses, raising children. And the environment that I grew up in, which was very disability inclusive, I felt was in stark contrast to how society viewed the capabilities of people who were disabled or the capabilities of people who identified as blind. And so I was curious that if all of these resources existed, why weren't they widespread? Why aren't these good ideas widely implemented? And that's how I chose to study accessible design in undergrad. I believe that good ideas fail without public buy-in. The challenge is to get people to change their mindsets about disability or healthcare or whatever issue that you're working on, and then connect it with something that they already care about so that they can actually move to action. And that's what we'll be talking about today. So here are a couple of tips that I've learned in my experiences with advocacy. As a sighted person, I learned a lot from the blind community. I've always loved art. Art has been the way that I communicate experiences that are hard to name. And increasingly, when I was working with people who are blind, who are cross backgrounds, I felt that regardless of our differences in experiences or beliefs, art was something that we could connect with. But I had a challenge because historically I've been a visual artist. And so when I was working with people who experience art through touch, I had to change my reference frame and find a new idea of how to convey information and connect with people. And so I started making things an experience. I would make things 3D. We had, immersive soundscapes, interactive polls online that were screen reader accessible, a whole range of things that broke open my idea of what art was. And I found that when we make things an experience where people can actually physically engage with something, whether they're offering their own opinion, whether things are an event, or whether they're physically touching a model, they remember more of what they interact with. And so I learned that as an advocate, I try to build participation, reflection, or dialogue. And this is especially important in the field of accessible design, where historically, I think the status quo fails because we try to design experiences or products or systems for individuals with disabilities without actually involving them in the process or listening to them. So this is also the idea of when you're working with the community, you want to find a way to get them actively engaged and excited on what you're working on. So some ideas are hosting live events, polls. We did an online skit raising awareness about student accessibility at my school, and public art. The second, which goes along with the first, I think, is to treat accessibility as a creative opportunity. Continuously, I learned that designing for diverse ways of experiencing the world strengthened my communication. And ultimately, I think if an idea cannot be communicated clearly and effectively, people won't really buy into it. So when I was having ideas, I started to ask, oh, when I tell these ideas to people, is my communication clear, multi-format, captioned, descriptionable? Is it free of jargon, multilingual, easily findable, and shareable? I think a lot of people spend time trying to come up with the perfect, great idea, but then they spend less time about disseminating that idea to the public. They might, do what everyone else is doing, do a few posts here and there, but I sort of changed my reference frame, thinking about how can I make things in as many formats as possible and ask people what they want in the communication, and really put a lot of my efforts towards once I have an idea, how do we improve upon the idea iteratively and market it in a way that's accessible to others. This is also a mindset shift because I think that when we treat accessibility as a form of creativity, we end up creating better solutions for everyone. I learned that things that we use every day, from Siri to auditory crosswalks to even the potato peeler, were originally designed with accessibility needs in mind. But because people thought out of the box and understood the ways that humans naturally interact with the world, they were able to create ideas that were widely implementable. This also goes with making sure that you understand problems that people are facing and get to the root of these problems rather than making assumptions about what problems you're trying to solve. Because if people aren't feeling like they need your idea or that you understand them and their problem, then your idea will probably not be implemented. This brings me to my third point, starting with things that people already care about. All people have personal experiences that guard their deepest emotions. And as was said earlier brilliantly by some presenters, I think it's tapping into these human emotions, values, wants, fears, and real stakes that move people to actually care about what you care about. And a part of this is building with common ground and then improving your argument from there. I've had this experience, working locally with people from all across the world through the National Federation of the Blind, but also in a legislative advocacy capacity. I was part of Prevent Blindness's Eyes on Capitol Hill group. And what we did was we were advocating for the EdHE Act, which is an expansion of the EdV Act, which is an expansion of the EdHE Act. And what the EdHE Act did was provide free hearing screening for children. And we wanted to provide vision screening for children as well, so that if they had, preventable visual impairments and they chose to want to, reduce the pain of those impairments, that they would have healthcare interventions earlier, or they could get earlier accommodations in school so that they could have a better quality of life. And when I was in this process talking to legislators, I had to talk to legislators across the political spectrum, some of whom didn't agree with my very identity or ideas, others who were already really sold on the idea. Some cared primarily about finances, others cared primarily about human rights in their communication. And so first thing that I did was notice the way in which they talked about their work and their values and tried to understand what they already cared about. And by then framing my language in terms of what they already cared about, their values, wants, and beliefs, I was able to build my argument from there. There's a quote that I really like from Aristotle, which was basically saying that if you're trying to have a conversation with someone, it's essential to define the terms. And I think that that's essential to making your ideas stick. If you ultimately want the same solution, but you're using terms where two people have different definitions of these terms, for example, equality or accessibility, then it'll be hard to get anywhere and actually implement these ideas. And I think that in an era where there's a lot of conflict, in my view, disability advocacy is the one thing that a lot of people can agree on. Disability affects all people, and I think that all people agree that people deserve to live lives of agency and dignity throughout their life. And I think starting with this fundamental core belief and bringing people in across, different spectrums is the way to get ideas broadly implemented in a variety of different contexts. So now with these principles, I want to share a few case studies that I did. So on a global scale, I had the opportunity to give a TEDx talk at Brown about accessibility. And this talk, surprisingly to me, reached 1.4 million views. It became the most watched TEDx talk of Brown in all time. And when this happened, I got asked by a lot of students and professors why it was so successful, and I started coaching future people to give these TEDx talks and tell their stories. Now I feel like, a huge part of the internet is luck, timing, and good fortune, but there were a few things that I think I did that really helped this idea that I had, which was changing mindsets about accessibility as a form of creativity, actually take root. The first thing was I used very clear, accessible language. I tried to give people a familiar entry point and then expanded the outreach of my talk through other forms of media. So I knew that I was talking to a lot of people, including people who didn't believe that people with disabilities, need to have creative outlets or that's important, even though that's my personal belief. But I think that all people could agree in general about the value of treating people with disabilities well, and about the value of creativity generally in our society, both in terms of personal benefit and in terms of employability. So I first started making an argument for creativity, got people on board, then making an argument for the importance of disability, then trying to anticipate the arguments that I would get, such as, things would be too costly, it's too much investment in a niche group, etc. And then once we were all on the same page, then I could make my argument. And I spent double the time, I would say, preparing my TEDx talk, figuring out how to advertise it. So I had my TEDx talk adapted into a series of illustrated drawings for people, for kids. I had, a podcast, a blog, a series of Instagram posts. I did events at Brown Live where I, showed the TED Talk. I talked to teachers in schools, special ed professionals, the Colorado Department of Education, and asked if they would share this talk. And by engaging with communities like this, learning from them and seeing how can I adapt what I have to fit a variety of different learning styles and engagement methods, I feel like I was able to present my idea to a wider audience. Sometimes this can look in a more creative form. I did this project, The Blind Urban Subject, with my friend Daniel, who has ocular albinism. And the idea for this project came because he was mentioning that it's impossible to explain to his parents or his sibling what he actually sees in a day-to-day life. And he wanted to create art that, reflected his experience. And we realized that when there are policymakers or pedestrians thinking about blindness or disability, they often don't actually know what people who are blind go through. There are misconceptions, for example, that all blind people see complete darkness. And we thought that if people who are blind paired with eye doctors and paired with politicians and created this piece of art explaining what they saw and how they navigated the city in everyday life, and then we had events where people who had the power to make decisions got to meet with the blind people who were living the consequences of these decisions every day, we would implement more accessibility in our neighborhood in Providence. And so this art was a huge success. We had over 15,000 viewers. We eventually expanded to Spring Street in Manhattan with the New York City Parks sponsorship. And this, I think, is a great example of how when you think outside the box in terms of spreading your ideas, especially through interactive art, you have a lot more engagement and public buy-in. A part of it was curiosity. These policymakers, including, Mayor Brett Smiley and Congressman Gabe Amo, told us that they get hundreds of emails about policy priorities or beliefs every day, but very rarely do they get an invite to a public art installation made by someone who is blind. That was very interesting and fascinating to them. And I think it was by piquing that curiosity or trying to spread this disability forward idea in a different way that we were able to bring people together in dialogue in the community. Art is a way of piquing that curiosity. So here's some just photos of our ribbon cutting ceremony, showing some of the elected officials who were involved, and just trying to show how much this garnered the public attention to an issue that was otherwise underaddressed in the city of Providence. And finally, here's something that I did in a clinic at the Hasbro Children's Eye Clinic. So I made this tactile mural for kids with vision loss and a lot of patients and families. And this was a challenge of trying to first bring a bit more joy and levity to a clinic, because I saw that a lot of kids were very stressed and it was very, dingy and gloomy, which didn't help their anxiety. But it was also a challenge to try and start early conversations about disability in a way that was accessible for people who were in elementary school. And so we interviewed 9-year-olds like, oh, what do you want to see in this clinic? And people said, we would love to see people with glasses or animals with glasses so that we feel less afraid going out into the world with assistive devices. They were like, oh, we like Alvin and the Chipmunks because they look like us, is what they said. And so we tried to increase this representation showing animals with glasses, but also did educational events showing that just as bats use echolocation or shrimps have extra color cones, there's a variety of different visual impairments that are just a new way of seeing. And this is a way that we could have conversations about visual impairment, health education, bringing in clinicians, families, and kids in a way that was much less daunting than traditional conversations. So I just wanted to show like a variety of these murals. And I recognize that, some of you audience members might not be artists and might be looking at this and feel intimidated. But what I want to, have people take away is the idea. Perhaps for you, this is sharing a personal story, and storytelling is the way that you express your creativity. Perhaps it's music or being unafraid to be a little silly on social media. Whatever that might be, I think these are great examples of showing how when you try to reach people that are traditionally not reached with your ideas, like children who have visual impairments, you end up implementing a lot more things. And finally, for social media, here was another case study. I did a series of illustrations trying to get viewers to ask, who is disabled? So I had a bunch of descriptions such as, is an ASL speaker disabled always in different environments? If I, someone who people would consider as able-bodied, walked around the world without a smartphone, would I be disabled by my environment? And the idea was that disability is a spectrum. It includes very many visible and invisible experiences. And also disability isn't purely biological, as a lot of people are taught. This is sometimes exacerbated by inaccessible systems and structures. So I had questions that I asked the audience, such as, whose tech is adaptive? With one person conventionally, probably we would assume as disabled, and another person conventionally would think as able-bodied, but both are using assistive technology. Or questions of dependence, and I had people vote and discuss online. And this is a way to start the dialogue. So what all these case studies have in common, I said before, they're participatory, accessible, start with fundamental values that people already care about, and ultimately turn ideas into experience. I'll just end on this note. I think that people don't remember information. They remember what they feel, what they experience. So I think that when we make ideas participatory, accessible, and more connected to the human experience, we get more people to buy into our ideas. Thank you so much.
Thank you so much, Rashika. Thank you for all that you do and making this world a better place.
Aw.
I am going to ask you a few questions. So the first question is, how can healthcare professionals and disability advocates use creative engagement strategies to shift public understanding of disability?
That's a great question. Would you mind repeating that one more time?
Of course. How can healthcare professionals and disability advocates use creative engagement strategies to shift public understanding of disability?
Yeah, this is a great question. So I think for healthcare professionals, there's a few things that come to mind for me. I think the first is when it comes to shifting public understandings about disability, first trying to understand who you're talking to and what they believe about disability. For example, I think that on the disability advocacy side, I've talked to many disability advocates who don't trust the healthcare system because healthcare professionals have come to caring for them with the belief that disability automatically means inability. And so when disability advocates talk to healthcare professionals as if, healthcare professionals are inherently biased or inherently anti-disability, of course, I understand the emotion behind this, but I think practically that just creates more division between disability advocacy and medicine. So rather, I think if a disability advocate is talking to a healthcare professional, for example, understanding that most medical education is taught assuming that disability is the worst case scenario, that if you do a poor job as a clinician, disability arises. And so you can understand that even the most well-meaning clinicians might be afraid of disability, and understanding where that fear comes from, acknowledging it, and then trying to expand their beliefs from there without judgment, I think is the way that disability advocates can approach healthcare professionals. And I think conversely, healthcare professionals can approach disability advocates by sharing some of their own experiences, by talking about stories of interactions that were positive that they've had with people with disabilities, and then using creativity to communicate information. So, for example, traditionally, a lot of research is just published in academic journals. And this is great because it shares information with other academics. But as a clinician, if you're doing research, you could go a step further by creating, directories online that people could use and access, or posting on social media, making a blog, or having easy to navigate pamphlets in your clinic. One example that I'll give is a mentor of mine, Dr. Forlenza. He specializes in diabetes technology, and he understands that technology is a very daunting concept, and a lot of people with diabetes also have disabilities. So he worked with a group of artists to create this, illustrated book. And a lot of nurses teach about disability with illustrations, so that this helps people who might not have English as their first language, people who might have intellectual disabilities, and makes people more interested and engaged in what he has to say. And then he also created this thing called Panther, which is an online directory that then people can Google and ask questions and engage with other people about which diabetes technologies to use and stuff like that.
Wow, thank you. Well, my other question is, what lessons from your work making diabetes technology accessible can be applied to other areas of healthcare?
Ooh, this is a good question. I think the biggest lesson that I've been thinking about recently is the importance of a frugal technology approach. I think as someone who wants to do the greatest good for the greatest amount of people, my first instinct is always to try and come up with a perfect solution. And sometimes that's a very high-tech solution, but that high-tech solution isn't necessarily useful if it's not affordable or easily implementable to the majority of people. So, for example, I was very passionate about trying to create diabetes technology accessibility for users who are blind. And first, I was encouraged by Dr. Forlenza to do a comprehensive literature review where rather than thinking about what's lacking or what needs to be changed, it was thinking about what's already working and how can we improve that. So once I did this review, I found that while, physical apps or physical devices are inaccessible, iOS apps have to be accessible under the ADA. And so a lot of companion apps that people use to read out their blood sugar can be screen reader accessible. But the issue is that clinicians don't know how to set up voice to text because they don't know that that's a thing. And then patients don't know. And so they're having accessibility issues. So I understood that the root sometimes is not technology or like grand solutions, but trying to connect knowledge groups. So I connected clinicians with blind people who knew how to set up this voice to text. The clinicians learned, and now the clinicians can teach future patients, and it's a much less frustrating experience for everyone. I think I learned that sometimes the best medicine is related to accessible design, where you're thinking about what problem most urgently needs solving. And then also, how can we connect people who have different areas of expertise in order to most immediately make an impact? Trying to build bridges is as important as building new solutions.
Thank you. I did have a question from the audience. Are you collaborating with artists in commercial industry to expand the greater market for universal design with science and technology for low vision BBI?
Yeah, so I guess I want to know more about what they're saying about commercial industry. I've definitely partnered with a lot of museums, so local artists who exhibit at museums or museum curators. And this is because I think that people engage a lot with information through culture and art. So, for example, local science museums, they'll have art exhibits that teach about science. And I've worked with these museum curators to try and make it more accessible for people who are blind. I've also worked with a lot of digital artists, student artists at Brown. Brown is right next to RISD, so I've worked with a lot of RISD students. And a lot of students have said that in addition to, their ideas being challenged about who can be an artist and what constitutes art, they are really excited that more people are buying their stuff and they're engaging their work because 1 in 6 people have a disability, and most people with disabilities want to, buy and experience art. So I think it was also helpful to hear that people really benefited from this inclusive approach.
Thank you. One last question. So, how would you recommend clinicians with disabilities engage with colleagues who are actively discriminating against them? How would you apply your principles of finding common ground in emotionally charged situations like this?
Oh, that's a really good question. And I think this question is significantly harder because now we're moving from, grand ideas that are like more conceptual or philosophical to someone's personal experience. So I just wanted to acknowledge that, of course, things are going to be emotionally challenging, and it's going to be really difficult. But I think that when people with disabilities like engage with the colleagues who are actively discriminating against them, I think I would try and see like why is this discrimination happening? I think there'll always be, this 1% who genuinely believes that people with disabilities do not deserve to be clinicians, and there's not much you can do, in that, just really sucks. But I think the vast majority, this discrimination is subtle. For example, maybe this colleague thinks that because you have a disability, you're going to take more time to do things and you're going to slow them down, or you're going to, create HR issues by asking for accommodations or whatever. So I think the first start is trying to understand, oh, are there patterns of this discrimination? What is the source of that? And then can I say things to this person, trying to, combat this doubt that they have in their mind, with, evidence backing up what I have to say. So, as an example, I was working with a student who wanted to be a nurse who has a series of chronic disabilities, and she experienced a lot of discrimination. And one of them was that she found out that people were giving her less bathroom breaks because they assumed that, oh, if you have a bathroom break, you're going to take a lot more time, you're going to like slow things down. And so, she explained, hey, I am seeing the same number of patients. And even if sometimes my appointments are slower, patient satisfaction is extremely high. In fact, oftentimes people prefer to go to me if they themselves have a chronic disability because I understand the lived experience. I'm adding value, and all people have, pros and cons, but the value that I add is significantly more, and patients agree with me, than, this extra time that I might take. And then this person had, a bunch of colleagues that supported her back her up. I think there's a lot of, strength in numbers, and when you try to approach things without anger and stick to the facts, critiquing, hey, the facts that you have about disability are wrong. I am entitled to this under the ADA. When we stick to, you know, a lack of personal attacks, like you are ableist, but rather, oh, this idea about disability is not, you know, factually accurate, I think people are able to engage more. But I can understand that that's hard when you feel like you're being attacked.
Well, thank you so much. You got a lot of great compliments in the audience chat, so please take a look at those, and everyone take a look at her TEDx talk. And back to you, Ken.
Great. Thank you. Thank you so much for that really energizing and fantastic talk and your thoughtful answers. And thank you, Becky, for your questions and for moderating. We'll take a break for lunch now. We'll shift the schedule slightly and reconvene at 12 instead of 11:55. And then with the breaks that we have kind of built in, we should be able to catch back up with everything. But again, we'll come back together in about half an hour at 12 for the next session. All right, great.